Global Hospital LB Nagar has launched a diabetic clinic on the occasion of the World Diabetes Day on 14th November 2013. The main aim of the clinic is to provide a comprehensive, cost-effective care which is convenient to all the diabetic patients. It will focus both on prevention of diabetes, treatment of diabetes so that they don't develop complications, and if at all they do, to provide specialist care so that they can recover earliest. We at Global Diabetic Clinic are a team which comprises of diabetic physicians or diabetologists, diabetic foot surgeons, general surgeons, orthopedic surgeons, dietitians, and also diabetic nurses and educators. We plan to hold a clinic on every Wednesday between 9 and 1 p.m. so that we give comprehensive care to all diabetic patients under one umbrella. We also have an ophthalmologist who will be doing routine eye examinations, retinopathy examination, and also referring them for necessary treatment as required. We also tied up to provide glucometers, that is diabetes checking machines, to patients at a reasonable rate, and also to provide diabetic foot special chappals or sandals of microcellular rubber to a reasonable rate, and custom made chappals to these diabetic patients. We also plan to give certain information booklets to diabetic patients, hold monthly talks on various aspects on diabetic education, and also then plan further events. With support from all our colleagues, we hope that this will immensely benefit the diabetic patient so that he can take care of himself and lead a normal life compared to any other person. So somebody who is having diabetes needs to take a lot of precautions. Starting from diet, he has to follow the diet which is given, eat almost at regular intervals, eat diet which is prescribed according to calories, eat foods which are not refined, fiber rich foods with lot of vegetables, and avoid fruits which have been exactly told to them, avoid fatty and oily foods, do regular exercise, take medications on time regularly, take foot care, and be aware of complications of diabetes when checkup is to be done, and also refer to doctor as and when he is been instructed to do so. With every year we are seeing increasing number of diabetic patients. India is among the second rank next to China in terms of diabetic patients, and Hyderabad particularly is almost the diabetic capital of India, you can say, because we have an increasing number of patients from all ages. We have from as young as about 15-20 years to as old as about 60-70 years. So there are various reasons why we are having maybe changes in lifestyle, our diet, lack of exercise, sedentary habits. So we are seeing a very increasing number of patients. When we detect diabetes, there are two categories. Somebody is called as a pre-diabetes, that is he has sugar slightly borderline diabetes where it is more than 100 but below 126 fasting, or between 140 and 200 post lunch. So when somebody is having such kind of sugars, he is not yet developed diabetes. At that moment, if we can tell him to take lifestyle changes, avoid smoking, take correct diet, do regular exercise, lose weight if he has excess weight, he can actually return to normal sugar and get control. Or somebody who has diabetes, if he can take these measures, sugar can come under control and his diabetic medications can come down.